what is it about having the process automated that's of such value to the hospitals and practice groups that work with ACR2 solutions?
Right. When people get audited, the first thing they typically do is freak out. Where is everything? And remember, again, you're supposed to keep this stuff for 6 or 7 years. So can you go back 5 years ago, 6 years ago, and identify that every person on your staff was trained on privacy and security and be able to demonstrate that? Most organizations can't. And so by the very process of using our system, we're logging, we're accumulating, you're storing the documents, everything is documented. When by the very nature of the way our system works, we are accumulating all of that information, we're storing it, and therefore, if you were to be audited, in fact, we take audit requests and we put those questions into our system, and you can do mock audits on yourself. But the reports that we generate actually show every one of the required areas and the either associated documentation or the proof of the timing of that information.
But you've actually been engaged by clients who hadn't worked with you before, and because they weren't prepared for an audit, they got into a compliance problem. But most of your clients don't call you in at the last minute after they're already in the hot water. They call you in to stay out of hot water. Is that correct?
Well, that's correct. But one of our first questions in any engagement today is, have you received an audit notice? And the truth is that we have had some clients come to us with an audit notice in hand. Any of the clients that were our clients previously that have been audited, we have 100% success with.
Well, that leads us to the question of, if I'm a hospital, as your hospital clients come to you, what is it that you help, or a physician group, what is it that you help them solve?
Right.
How do you work with them?
Right. Well, we have a complete solution for information security compliance and remediation. So stage one is do the risk assessment, then you can attest and get your stimulus funds. But after that, you now know what you need to work on, and that's the beauty of it. Typically what that leads into is the development of policies, and again, in compliance, if it's not written, it doesn't count. So you may have policies or believe you have policies, you may have procedures, but if they're not documented, they don't count. You need to have security awareness, privacy training, and you have to have technical controls. All of those are identified in the process of completing the risk assessment.
When I hear the scope of the work that you do, I flash forward immediately and think, well, how are we going to get all that done? Physically, I guess, and economically, how do you do this?
The beauty of a program like ours is we use what's called the NIST, HHS, Health and Human Services, and the Office of Civil Rights. The NIST is complex, but we've done to the NIST protocols what a tax program does to state and federal tax laws. So even though you may not be an expert in taxes, you had to read the tax code, you never get through it, we've read it, we've got a system now where all of that's integrated into, and in the same way you can do your taxes without understanding the tax code. If you use our product, you are doing everything that you are required to do. Now,
I have a quick question. It's pretty basic. What does NIST stand for?
Okay, I'm sorry. So in the United States, there's a National Institute of Standards and Technology, the NIST. So the Congress has given the NIST the authority to develop the standards by which these laws are now implemented.
So once I've engaged you to do a risk assessment for my provider practice, these protocols and your software will, with our input, will cross-match what we're doing against what is required to be done, and provide us with a working list of where we're in the green and where we're in the yellow, so to speak, and where the gaps are, where we're in the red. Is that
right? Right. But again, we've developed over the hundreds of risk assessments that we've done a methodology that you get the best progress in a very structured way that's been repeated, and so we can give you a lot of guidance to help you do it very cost effectively.
What's the advantage for bringing in someone outside that I'm going to have to pay, as opposed to just having someone on my internal staff understand what our requirements are and do it and teach us how to do it internally?
Right. Well, the advantage is we're much more cost effective. We do this all day long. We've done it hundreds of times. A lot of organizations that they go out and try to figure out what it means to become compliant in information security regulations will spend tens of thousands of dollars trying to figure it out. There are specialists that have put together the programs that understand the ins and outs. We monitor all of the enforcement regulations so we know what they're looking for. But we have people all the time say that the thing I like about a program like yours, it's like a board game. You open the board, you start here, Candyland, Chutes and Ladders, whatever. You start at the beginning, you make it to the end, you've done everything that's required. A lot of people sit around and say, is that all there is? What else do I have to do? So the cost of an organization to have an internal compliance department is very expensive.
You also, it sounds like you overcome confusion and you achieve a level of certainty that lets people sleep at night.
Quick. The assurance that you're doing the right stuff, again, because we've been audited, we've submitted the stuff, we've had engagements, we know what is considered best practices, we've got a wealth of knowledge, a common body of knowledge that clearly meets the requirements, and if you're trying to discover that for yourself, it's very expensive.